Welcome to Produce Talks, brought to you by the Canadian Produce Marketing Association. Each episode brings you fresh insights from leaders across the produce supply chain, growers, retailers, innovators, and experts shaping the future of fresh. Wherever you work in the industry, we're here to keep you informed, inspired, and connected. So let's get started.
Hello, everyone, and welcome to Produce Talks. My name is Sue Lewis. I'm the VP of Marketing and Events at CPMA, and I'm delighted to be speaking today with Veronica Rouse. Veronica is an award-winning registered dietitian and certified diabetes educator. With over a decade of experience, she helps individuals lower their cholesterol and blood pressure through practical, evidence-based nutrition strategies. Veronica is the founder of The Heart Dietitian, a trusted online resource for heart-healthy recipes and easy-to-digest information. Veronica, welcome to the podcast.
Thanks so much for having me.
We're really excited to kick off Nutrition Month, talking with some of our friends and trusted dietitians. So maybe I can ask you just to tell us a bit about yourself and your line of work.
Yes, absolutely, Sue. Well, as you mentioned, I'm a registered dietitian. I live in Ottawa, and I've built this brand called The Heart Dietitian. So I specialize in helping busy people lower their cholesterol, their blood pressure, and reduce the risk of heart disease. But I do this in using food. So trying to translate complex nutrition information in simple, practical systems that people can implement and execute, because ultimately we eat food and not research. So trying to disseminate that information as clear as possible is kind of what I do. And I can do that in many ways. So I'm a content creator, and I create information for Instagram, YouTube. I have a blog, and I do like to create recipes because, as I mentioned, we do eat food. So that's always a fun and tasty thing that I like to do for my work. But yeah, my work focuses heavily on eating more whole foods. So that includes fruits and vegetables, whole grains, beans, nuts, seeds, and incorporating dietary patterns like the Mediterranean diet, the DASH diet, the vegan and vegetarian dietary patterns.
Sounds like we should have been doing this one in your kitchen over lunch. That would have been great. So in terms of your day-to-day work, what kind of strategies do you do to help improve health by improving fruit and vegetable consumption?
So my nutrition philosophy is always about adding foods, not restricting. So focusing on what people can eat more of. And I think that really helps to help them reach their health goals. And that can be done in so many different ways. And I like to do it in repetition. So using the same message in different ways, because people learn in different ways, right? Some are visual learners, some are auditory learners. And thus I do it, through video, blog writing, cooking demonstrations. So some do happen in my kitchen, actually. I love creating recipes because that's when I hear the most from my clients saying, "Oh, Veronica, I tried this recipe." And then I know that they're eating those foods that do provide therapeutic benefit. So those are some of the day-to-day activities I do. But yeah, overall, I have this passion of teaching, of eating more produce, more whole foods that will ultimately help people live longer lives, which is what people want in the end. So keeping it approachable, and then just helping inspire them by doing everyday things too. So sometimes I'll even just hop on my Instagram and share in my stories what I am eating for lunch, or maybe what I'm throwing in my kids' lunch boxes in the morning, just to help people with more exposure as well as make it feel more approachable.
So even though your practice is largely geared towards adults and specifically to high blood pressure and helping them lower their cholesterols, you mentioned what they're putting in their kids' lunches. So do your clients come to you kind of looking for a family-wide approach to their situations?
Absolutely, Sue. No one wants to be making 2 meals at dinner time. So trying to fit everybody in the families, their health goals. And in the end, those go back to those dietary patterns I spoke about at the beginning, the Mediterranean diet, the vegan vegetarian diet. Those are diets that not only will help lower cholesterol and blood pressure, but they can help young kids as well as, adults who are living with diabetes. So ultimately, I think the message comes down to eating more whole foods, and that can be good for everybody.
Absolutely. Unfortunately, we know that Canadians generally aren't eating enough fruits and vegetables. What are you hearing from your clients about the barriers that they face when trying to get more fruit and vegetables into their diets?
Exactly. It does come down to looking at those barriers, right? Because you're right, we aren't eating as much as we should be. So what do I hear from clients? Well, time. Time is one of the biggest barriers, and it could be time to go grocery shopping, to purchase the foods, time to clean the produce, where to store it, like the unknowns of how to best store produce, cook it, right? Comes back to those recipes. So I think time would be one. Overwhelm, the overwhelm of information we have on the internet. Individuals are going down these Google rabbit holes and spending a lot of their time there that they're exhausted at the end, not knowing what to do, and not necessarily implementing anything. So a lot of that information overload and overwhelm would be another barrier I see. And cost. So food cost has gone up, absolutely. On average, Canadians do spend relatively small share of their income on food compared to other countries, which I don't think a lot of us are aware of. But we do have to recognize that food costs has gone up. And I think how I approach this barrier would be looking at food waste. So a lot of my clients are talking about purchasing the produce, but then actually not using it. So kind of overcoming those barriers of how to store the food properly. Can you store them in clear containers and keep them accessible so that you can see them and eat them helps a lot with the food cost aspect of the barrier.
Yes, we certainly hear that from people as well. And they often don't make that connection between the cost and the food waste until it's pointed out to them. I know that our team here at Half Your Plate has lots of resources about buying and storing produce to help maximize the life of your produce. And also, if it's getting near the end, I can still use a lot of it. Some of those things go great in soups and smoothies or just even in the freezer for future use. You can avoid that food waste with just learning some tricks and tips for sure.
Absolutely. Those are really good.
If you had to give us like your top 3 produce tips, let's talk about the time thing because that does come up. Families are really busy. What are your top 3 tips for folks to get more fruit and veggies in their diet, even with the time crunches?
The one thing my clients have enjoyed, what we've talked about is instead of going grocery shopping, getting food delivered, there's a lot of resources now that help with that. And that helps with the time. So then they have this extra hour of time where they can spend that meal prepping. So having that produce come to their house, then they can wash it, clean it, chop it so that it's in their fridge, ready to use, kind of like a grab and go. And I think that has really helped a lot of individuals to consume more of it, right? Because they don't have to just even getting that cutting board out and that knife and having to wash those things after is a barrier. So if we can do that in one sweep once a week, it gets done a lot faster. So that's one tip I think has really helped. And then once they are prepped, having them in a clear container. I like to call what I do is I have a veggie bucket. So it's a big, I actually use like a casserole dish that's clear and lots of different chopped up, whatever I have that week, but it could be carrots, celery, cucumbers. And all I have to do is take that lid off. I put it on the table while I'm making dinner and my whole family is grabbing that because that's when we're hungry and it's a time that we want to eat. If that food is there, it looks delicious. Produce is so colorful and beautiful. And then if you pair it with something like a dip, it makes it even more fun for kids to consume. So having that.
No excuse when it's all chopped and ready to go, right?
Exactly. And like I said, you don't have to do much to make it look pretty because of the beautiful colors that they offer. Yeah, so I think those would be my tips that have worked with some of my clients.
As a dietitian, you must collaborate with a number of other professions and with your recipe development and people like chefs and store managers. Can you tell us a little bit about how that works? Like what the relationship is between yourself as a dietitian and other people in the food supply chain?
Yeah, absolutely. So collaboration is awesome because we all have different expertise. So I have worked with chefs. They are very knowledgeable and they can create these beautiful recipes, but they're not necessarily trained in nutrition or therapeutic nutrition. So that's where I can come in and help them. So once they have a recipe, I can make some practical adjustments to maybe help add or swap a few ingredients that would support a cholesterol reduction, blood pressure management. while maintaining the flavor and structure that they have created. So definitely working with chefs in that manner. For store managers or retailers, I would say using more of that education, going into the store, filming short videos about how you can grab a few quick items that are in the store already. And then it's, familiar to people because they've been in the store before. They know where to go. They know what to grab, and kind of fills that barrier of time, right? They can just go and get it done. So I think definitely collaboration is really important. And ultimately, we can all help to work together to get more produce on Canadians' plates.
Try and move that needle a little bit. Is there a message you'd like to share with the produce sector? So from the health community side of things, what would you say to the industry about working with dietitians, and how can the industry leverage your knowledge, or how can we help you with your clients?
Yeah, absolutely. So dietitians are trained and ethically responsible for sharing evidence-based messaging with the public, which not all influencers have that lens that are working through. So I think dietitians can be that trusted translator and that credible translator as well. So partnering with dietitian goes beyond just posting about a product, but I think knowing that we're also trained in behavior change, and it's not just about sharing information, but really helping and knowing how to help people turn that into action.
Perfect. I think that's great advice for all of us. We see more and more of our CPMA member companies interacting with the dietetic community, understanding that trusted translator voice is very important for Canadians, because it is a noisy space out there and in the world as people are trying to look for credible information.
Absolutely.
Just in closing, I understand you're also a cookbook author with your cookbook, Easy Steps to Lower Cholesterol. How did that project come about?
It comes back to clients wanting to eat food and not nutrients. So trying to get them to eat the food means developing recipes and finding recipes that include the foods that provide the therapeutic benefit. So I was often talking to my clients about how they can get that food on their plate, but I felt once I shared recipes, they would implement it more. And so that's when I started cooking in my kitchen and sharing the recipes on my blog. I got some good feedback about that. And then I developed that cookbook to help keep it in one condensed resource for individuals.
Oh, fantastic. And for our listeners, that cookbook title again is Easy Steps to Lower Cholesterol, and it is available on Amazon, so you can check it out from Veronica. Thank you very much for sharing your expertise with us today. As I mentioned earlier, it is March's Nutrition Month, so we're excited to talk to people that are trying to help all of us Canadians have better nutrition and include more fresh fruits and vegetables in our everyday choices, and fill half our plate with fresh fruits and vegetables at every meal and snack occasion. So stay tuned for more information on Produce Talks as we continue our Nutrition Month series. Until next time, take care and never stop growing. Thanks, Veronica.
Thanks, Sue.